Hi, I'm Dr. Lee Coleman, and I'm a psychiatrist, and I'd like to talk to you in a series of sessions about psychiatry and our society. I've been a psychiatrist for almost a half a century, and I really feel that psychiatry is misplaced in the way our society handles it. Let me tell you a little bit about what I mean by that, and a little preview of the kind of things that we'll go into some depth about. Psychiatrists have a very special place in our society. First, they are the leaders of the mental health professions. They're given authority, prestige, and salaries to go along with it that place them at the top of the profession because they are the only medical doctors in the mental health field. Psychologists are not medical doctors, although they may be doctors, PhD doctors. Social workers, various types of counselors. There's a history as to why psychiatry is in that position. From my experience in psychiatry, what I see over and over again is that psychiatry does not deserve the role that it has. Not because of ill will or lack of expertise or conscientiousness on the part of individual practitioners, but because of social movements, economics, governmental policy, and science, which is not what it's claimed to be. I want to talk to you about all those things because I feel an obligation at the end of my career to contribute to what I hope will become a movement to recognize the way psychiatry is not functioning the way it should be. Let me just explain a little more about how serious my concerns are. From a profession which at the beginning of my career was perhaps ready to move in a better direction with regard to better questioning of the psychoanalytic model, has gone deeply into another direction, medicalizing of psychiatric problems, mental problems, a disease model which relies on drugs, which are called treatments. And psychiatry continues to have the power to force those treatments on people. I want to talk to you about how those policies hurt people and hurt society. So we have good people who end up doing things which are not good, in my judgment. The legal role of psychiatry is another part. We ask psychiatrists continually to help us with difficult problems, which none of us can do in a scientific way. So we divert our attention from what could be better solutions. These are areas that I've worked in all of my career. None of my positions have arrived at lightly, but I want to give them to you and have a discussion that will allow you to think about them. In addition, I'm doing it in this filming in my home for a specific reason, because this is the place where most of my career was taking place. When I was seeing patients, I'm now retired from that part of my work, this room was the waiting room. Another room was the therapy room. In addition, I have done a lot of things with my time to keep myself fed, to sustain myself in the struggles that comes with being critical of your profession. So you're not going to hear in my blog the standard psychiatric theories about treating diseases with drugs, with electroshock and other various physical maneuvers. It's going to be much more searching than that. There will be many people in the mental health professions who won't agree. I know that from half a century of experience. But what matters is what you think. I want to have a chance to provoke your thoughts a little bit, because society must decide on these issues. They're much too important. As they say, war is too important to be left to the generals. The role of psychiatry is much too important to be left to the doctors.